You ready?
All right, so these are some mobility drills for your upper back, so thoracic. So thoracic works with both extension and rotation. So it's important to work on both of those components to get the best range out of you. So I'm going to show you some progressions here. So which one you do depends on what your physio tells you. All right, so firstly, coming up with a foam roller, you want to go all the way up as high as you can. Now you've gone too far if it's just your neck moving. So you want to get a little bit further. Think about putting your elbows together and you actually want to be extending over the foam roller. And you just want to do a couple of repetitions in this spot. Okay. And then you just want to move up just a couple of vertebral segments and then go again. Okay. So we're really trying to pivot over the vertebra to try to get us some extension happening. And then you're going to go to the next spot and you're going to keep on going down until you get to a point where when you go back, your bum wants to lift off the ground, then you've gone far enough. Okay? It's not doing up and down. That's just for muscles, while the one I've just shown you is actually for the back vertebral segments to improve. All right. Another option is some book openers. So knees on top of each other, keep your hips stacked. So when you're coming back, you're not opening up here. You just want to keep them on top of each other. And then you're just going to open up, follow that hand, keep watching that hand as it goes around, and then coming back again. Okay, and over, and back again. Make sure you've got something to support your head as well, so you end up with a sore neck. You can have a bit of a pause at the end and a deep breath if you like, but it's not necessary. You can just go out and forwards. All right, and then after that, you can do another progression is actually doing 4-point kneeling, so up on your hands and your knees, and then you kind of come up and then all the way through. So we call these threading the needle. And then up and then back again. So now we're starting to get into a movement where you're actually having to use your muscles to control yourself through range. It's one thing to have the range, but another thing to have the strength to get through the range and actually use it. So the last progression I'm going to show you, you're going to grab a band, or it could be a cable at the gym as well. Yeah. In a lunge position, up nice and tall, and you're going to keep your elbows straight, and you're going to rotate out and all the way back once again, following your hand with your gaze. So you're actually rotating all the way through and back again.
Yeah, okay.
So once again, this is getting you the strength to use the range that you've got. Main points here are staying nice and upright, not just turning through your hips, which would just look like this, where you're turning your hips here, and making sure that you're following your hand to get really all the way around. Fantastic. So which one of those you'll do depends on which one your physio thinks is most important at the moment. They usually need to be done regularly to keep your mobility going, to first get your range going, but then after that, use a bit of a maintenance program is good enough. But get in touch if you've got any questions. Hope that helps.